Good morning, everyone. Dr. Patmos again. It is still April 16th, just where it was same day when I did the last video. So now I've got one about following. I can't help myself. This is following up on the measles situation in Florida. Nice article today in the Orlando Sentinel that discusses how measles is exploding in Florida right now at the same time that the vaccination rate is plummeting. Well, lo and behold, yeah, it's interesting that now the media is picking up on this. And it is a serious situation in parts of, I mean, parents are rejecting vaccination in large numbers. Vaccination rates have declined dramatically in Florida and in some places reaching third world levels, which means that Florida is becoming a third world nation. Measles is now spreading rapidly in Florida. Now, for those of you who are not clinicians and don't understand, measles isn't just a rash and a fever. You can get really, really, really sick with measles. You can die of measles. And if you don't die and you get really sick, you can get a very bad encephalitis, a virus infection in your brain. And even if you recover, you can have a late outcome called subacute sclerosing panencephalitis, which is basically an inflammatory process in the brain that destroys the brain, and these patients die. And so that's what we've got going on in Florida right now. It's all totally preventable. The measles vaccine is like 98, 99% effective. It's incredibly safe. We've had 70 years of experience, 60 years of experience with this vaccine. It's incredibly safe and it's incredibly effective for a disease that is incredibly contagious. If you have active measles, even if you don't know it, you're still incubating the virus, and you are in the presence of someone who's not vaccinated, their likelihood of contracting measles from you is probably as close to 100% as it can be. We have a highly contagious, potentially deadly, devastating viral infection that is completely preventable by a safe and effective vaccine. And in Florida, Governor Ron DeSantis and Joseph Lodapo have instituted this policy of in discouraging vaccination. Now, here's a piece of this that no one else has said, and I'm not 100%. I don't have absolute proof of this, but it makes the best sense. The United States is now, we were just declared we had eradicated measles 25 years ago. We have enjoyed the status of being a measles free nation for a quarter of a century until last year. And last year, 2025, we saw a ridiculous outbreak of measles, thousands of cases that has now spread into 2026 and is ripping through the country. We had well over 2,000 cases of measles in 2025 in the United States, with 3 deaths that I know of. And now we've got already almost 2,000 cases in 2026. We're talking about now 6,000 cases. Now, bear in mind that the reported cases is always a fraction of the real number. The real number is higher because some people just don't go to the doctor. They get a kid with a rash, but he's not that sick, so that it doesn't get counted. Sometimes the doctors don't recognize. I mean, not a lot of doctors have seen measles. I mean, after all, it's been eradicated. So a lot of your younger doctors have never seen a case of measles and may not recognize it. And then they may not go through the reporting process. To report a case takes time. You have to, fill out paperwork, and a lot of doctors just don't have the time to do that. So if you see there are 1,000 reported cases of measles, you can be sure there's probably 2,000 or 3,000. So we're up to about 4,000 or 5,000 cases now in the 25-26 outbreak, which really means there's a lot more. There's probably 10 or 15,000 cases, and there's no question that with that many cases, some of those children are going to have bad outcomes. Preventable, totally preventable. But here's the point I want to make. This thing in 2025 really erupted in early 2025 in Texas. but it didn't start from scratch. It didn't start de novo out of thin air. They don't really know exactly how it got into Texas, but consider this. Just a few months earlier, there was measles that broke out in Florida, and Lodapo, Dr. Joseph Lodapo, issued a proclamation, a jaw-droppingly stupid proclamation. He said that parents in normally everywhere in the world, if you have an unvaccinated, exposed person with measles, you quarantine them for, I think it's like 2 weeks usually, because they're highly contagious, and someone else who's not vaccinated can get it. Now you got to bear in mind there are, some young children who are too young to be vaccinated, so they're sitting ducks for this person who's exposed, incubating the virus that has no symptoms, and they could spread it to an unvaccinated person, and that could lead to their death. Well, so that's why the standard recommendation is if you're unvaccinated and exposed, you get quarantined until you're absolutely sure that you're not incubating and spreading the virus, that you're not coming down with the disease. Well, Dr. Lodapo um, issued a proclamation that everyone in the world who knows anything about this went, what? What? Are you crazy? He issued a proclamation that said that parents, if you have an exposed, unvaccinated child, don't worry about it. Just send them to school. It's okay. Who's the state to tell you you have to quarantine your child under this ridiculous medical freedom concept? So that's what Lodapo did. And as a result, um, measles, there were a lot of cases. There were quite a number of cases of measles in Florida in the summer and late summer and early fall of 2024. Some of those cases were clearly documented to have spread to other neighboring southeastern states like, Mississippi and Louisiana. And then just a month or two later in 2025, it shows up in Texas. Now, I suspect that the cases in Texas that then spread around the rest of the country probably were sparked from Louisiana and probably came all the way back from Florida. So I am speculating, but it is my speculation that the current measles outbreak throughout the United States in 25 and 26 actually was an extension of what happened in Florida in 2024, and that it's really Dr. Joseph Lodapo who is responsible for ruining our measles disease-free status and sparking this nationwide outbreak now of measles, from which some children will not have a good outcome. And how did Dr. Lodapo get to be so powerful and get his job? Well, that's a story that is also in the text below. It's a very interesting story because Dr. Lodapo actually doesn't have the proper qualifications. He is an internist, yes, and he has a master's degree in public health, yes, but he is not an infectious disease doctor, and he has no training in infection control and hospital epidemiology. So how on earth is he in a position to advise the state about what to do about infectious diseases? He's not an infectious disease doctor. I mean, it's perfectly appropriate for him to be the state surgeon general, but on matters of infectious diseases, he should be deferring to his colleagues who are infectious disease doctors, which he's not doing. In fact, he's disregarding their advice and going contrary to their advice. So there you have it. Dr. Ron DeSantis and his attorney general, Dr. Joseph Lodapo, have probably, as best as I can determine, ignited a nationwide measles outbreak that is going to place our disease eradicated status at risk. I'm sure we've already lost our eradicated status. We're now joining the third world with measles. Now, some have said, oh, the cases in Texas, that came from somewhere outside the United States. It's these immigrants who are bringing these diseases in. Bear in mind, the United States is now not among the highest tier of vaccinated countries. We've now slipped into the middle tier. So there are basically three tiers. There are countries with high levels of vaccination. We're not one of them anymore. Thank you, Robert Kennedy. Thank you, Donald Trump. Thank you, all the anti-vaxxers. We have now slipped We're no longer in the top tier of elite countries with high levels of vaccination. We're now, kind of in the middle tier, and there are some countries that are third world countries that are in the lower tier, and we're heading in that direction. A lot of our neighbors in Central America, these countries that are flooding us with these terrible illegal aliens, according to Donald Trump, like Mexico and Guatemala and El Salvador and Honduras and Belize, actually have higher immunization rates than the United States does. The highest immunization rates in Central America and the Caribbean, I think, are Cuba and Mexico. They surpass the United States. So anybody who says, well, it's these immigrants who are bringing measles in, it's kind of the other way around. We're putting them at risk because we're the ones with the lower vaccination rates. So the United States is becoming a third world country with respect to vaccination, and it's showing up with these contagious infectious diseases that shouldn't even exist. I mean, if everybody got vaccinated, measles would go away. Measles wouldn't exist anymore. It would be like smallpox. It would be a disease that doesn't exist anymore because the only place the virus persists is in infected human beings. It doesn't exist anywhere else. So if you make all human beings immune, measles would become a disease of antiquity, a disease in the history books. It wouldn't exist anymore, just like smallpox. And oh, by the way, there are a lot of diseases that we could completely eradicate from the face of the earth if only we could vaccinate people. But we've got these anti vaxxers, people like Lodapo and DeSantis, who want to make sure that nobody is ever forced to get a vaccination. There's no mandates, no requirements, make it totally optional. Well, that just guarantees that people won't get vaccinated and diseases are going to recur. The only way they work is if people get them. So if you want to eliminate diseases, everybody's got to be vaccinated. That's the nature of immunization. That's the nature of reality. You don't like it? Well, then enjoy the diseases that you're going to bring back. Have a great day, and tying it all together on measles. And sorry to hear that Florida is having such a problem, but it's your fault, Florida. You put a dumb governor in there, and he put in an even dumber surgeon general. It's your fault.